Pterygium, also known as Safa's eye, is a wing-shaped fold of conjunctiva, encroaching upon the cornea from either side. This video contains information on its causes, symptoms, pathology, types, complications, differential diagnosis, and treatment. Before moving to further information, if you learn something or if you find information provided in this video as helpful, please motivate us by subscribing, liking and sharing this video. Causes of pterygium. Etiology of pterygium is not definitely known, but the disease is more common in people living in hot climates. Therefore, the most accepted view is that it is a response to prolonged effect of environmental factors such as exposure to sun containing ultraviolet rays, dry heat, high wind, and abundance of dust. Pterygium is more common in elderly males doing outdoor work. Genetic factors also appear to be involved. Pathology of Pterygium. Pathologically, pterygium is a degenerative and hyperplastic condition of conjunctiva. The subconjunctival tissue undergoes elastotic degeneration and proliferates as vascularized granulation tissue under the epithelium, which ultimately encroaches the cornea. Deposition of iron seen sometimes in corneal epithelium anterior to advancing head of pterygium is called Stocker's line. Parts of pterygium. A fully developed pterygium consists of 3 parts. Head, an apical part present on the cornea. Neck, a limbal part, and body, a scleral part, extending between limbus and the canthus. Types of pterygium. Depending upon the progression, it may be progressive or regressive pterygium. Progressive pterygium is thick, fleshy, and vascular with a few infiltrates in the cornea, in front of the head of the pterygium, called cap of pterygium. Regressive pterygium is thin, atrophic, attenuated with very little vascularity. There is no cap. Ultimately it becomes membranous but never disappears. Symptoms of pterygium. Pterygium is an asymptomatic condition in the early stages. Many patients do complain of the cosmetic appearance of the eye either with some of the symptoms or as their major complaint. Symptoms of pterygium include persistent redness, inflammation, foreign body sensation, tearing, dry and itchy eyes. In advanced case, visual disturbances can occur when it encroaches the pupillary area, or due to corneal astigmatism induced due to fibrosis in the regressive stage. Occasionally diplopia may occur due to limitation of ocular movements. Complications of pterygium. Complications like cystic degeneration and infection are infrequent. Rarely, neoplastic change to epithelioma, fibrosarcoma or malignant melanoma, may occur. Differential diagnosis of pterygium. Pterygium must be differentiated from pseudopterygium. Pseudopterygium is a fold of bulbar conjunctiva attached to the cornea. It is formed due to adhesions of chemosed bulbar conjunctiva to the marginal corneal ulcer. It usually occurs following chemical burns of the eye. Other conditions that can look similar include a peduncula, tumor, or Terrien's marginal corneal degeneration. Prevention of pterygium. As it is associated with excessive sun or wind exposure, wearing protective sunglasses with side shields, and/or wide-brimmed hats, and using artificial tears throughout the day may help prevent their formation or stop further growth. Surfers and other watersport athletes should wear eye protection that blocks 100% of the UV rays from the water. Treatment of pterygium. Pterygium typically do not require surgery unless it grows to such an extent that it causes visual problems. Surgical excision is the only satisfactory treatment, which may be indicated for cosmetic reasons, continued progression threatening to encroach onto the pupillary area, and diplopia due to interference in ocular movements. Recurrence of the pterygium after surgical excision is the main problem, approximately in 30 to 50% patients. However, it can be reduced by any of the following measures. First is Transplantation of pterygium in the lower fornix, also known as McReynolds operation, is not performed now. Second is, postoperative beta irradiations, this method is not used now. Third is, postoperative use of antimitotic drugs such as mitomycin C or thiotepa. Fourth is, surgical excision with bare sclera. Fifth is, surgical excision with free conjunctival graft taken from the same eye or other eye is presently the preferred technique, and sixth is, in recurrent recalcitrant pterygium, surgical excision should be coupled with lamellar keratectomy and lamellar keratoplasty. Thank you for watching this video. If you still not subscribed my channel, please subscribe for more such videos. If you have any comments or questions, please write in comments section. Please share this video with your friends and do not forget to hit the like button.